all are meeting the needs of what the community is really, just crying out literally for.
Our services are free. We're all bilingual, and we just help people connect to services or resources that they need that are affecting their mental health.
We're really excited about this. This is something that is probably going to be built here in the next 2 years, but it's going to be an incredible resource for our community because currently, anybody that has a behavioral health crisis that needs to, get hospitalized is essentially, shipped away from our community to either Denver or Grand Junction, which both of those are a couple hours away. And it's, we know that recovery is much more effective when it happens in community, in a community-based location where your family's nearby, where, so we're really excited about that. One of the things that a lot of people don't know that I think is important to mention here is this misconception that you brought up, that Olivia's fund is only for folks that are in really dire financial circumstances. And that's really something that we want to start breaking the stigma around because that's not the case.
Hello, today we're here with Michelle Dibos and Coco Andretti with Eagle Valley Behavioral Health, which is an outreach partner with Vail Health. There's so much going on in this valley relative to Eagle Valley Behavioral Health, and we are here for you to enlighten us because we want to learn more about what all your organizations are doing.
Absolutely. So there is so much going on, as you say, right? We have been growing very rapidly over the course of the past 2 years, even through COVID. I feel like it propelled our expansion because there was so much need.
Yes.
And we are not stopping. So we have a hospital, an inpatient psychiatric hospital that's going to be built here in the next couple of years. That's going to be in the Edwards location, in the Edwards Community Health Campus location. We have a new service coming online here in the next year that's called the Uyghurs Clinic. And we're going to be doing a lot of very exciting specialty treatments out of that clinic, so we'll share more soon.
You have to come back, stay tuned, you gotta go back.
Exactly.
We're not going to share everything with everyone.
It's a secret right now.
Yeah. And then the other big service line that we have that is already seeing patients, and that's out of the Edwards location as well as other Colorado Mountain Medical locations, is the outpatient therapy services. So, you can schedule an appointment with an outpatient provider and you can get somebody, come in and see somebody for your behavioral health care needs.
Yeah, terrific. And we just want to make sure, because it is hard to keep up on everything here right now, which is a good thing. We're really meeting, or you all are meeting the needs of what the community is really, just crying out literally for. A lot of heartbreaking stories that, is a lot of the reasons why some of these have been funded and whatnot. But just so people know, I didn't know that there was actually spaces that are already functioning here. So you've got programs for adolescents, for adults, but tell people though, I think it would be important, let them know what they can stop here for right now, today.
Absolutely. So if you stop the Edwards Community Health Campus, we have a long-term vision, right? So we are partnering with a few agencies. We have the Edwards Community Market, or the Community Market here in Edwards. It's not the Edwards Community Market. It's the Community Market that operates. It's a partnership with the Eagle Valley Community Foundation. We have My Future Pathways. And then as it relates to behavioral health, we have the outpatient behavioral health services. And we have case management services, which is what Coco does. So
Tell us a little bit more about that.
Yeah, that would
we don't
be
know
good.
what that
And
means.
that's here located right now. So anyone, I just want to make sure for crisis mode, this is not the place to come to.
No,
so
that
we
would
need
be
to
the
make
Hope
sure.
Center.
Right, the Hope Center. There's great resources. We'll make sure that's listed. But explain what the case management.
Yeah, so it's 3 of us. We're all behavioral health case managers, and we're located here in Edwards. So kind of what we do is we help people connect. Our services are free. We're all bilingual, and we just help people connect to services or resources that they need that are affecting their mental health, and no matter what. So we cater it to what the client needs and what the client's needs are at the moment. So we work with them very individualized, and whatever they need, we're here to help them.
And I think one of the really cool things about the case management program is that, if you don't know where to start, you're like, I could use a little help, but I'm not really sure what specialty or who to go see or what the providers specialize in. This is a great place to start. You can call the case management line, or you can come visit us, and we can help you figure out a plan of action and a treatment plan, or a plan of care for whatever it is you need, in order to be healthy and thriving and well.
And again, this is for adolescents and adults as
Yeah,
well.
it's for any age range. We've had anywhere from children that are super young all the way to adults. So it doesn't matter what age, we're here to help you. And like Michelle said, yeah.
And cost.
There's no cost, so we're free. Anyone can just show up. We do not ask any questions, and we're just here to help you and really focus on your behavioral health and just get you started.
And when you say behavioral health and the services you offer, can you just provide sort of a range of ideas of things that you can help with? Be a little more specific,
Yeah,
whether it's depression,
definitely.
anxiety, or
So,
alcoholism.
like I said, it's all catered to an individual. But for example, if you're someone that doesn't know where to go, you can call us, and if it's you need help like managing your stress, or you're suffering from anxiety or depression, then we'll just cater it. So it doesn't matter whatever it is, but it can be anything literally. Even if your kid needs an evaluation, we'll help you figure out who does evaluation, or if you need other like resources, we'll just help you basically.
Or insurance
Oh,
navigation.
yeah.
Well,
insurance
that was my
navigation
next
is other
one,
part.
is because that is another confusing part, because I think some people are scared to ask because they don't know if it's covered by insurance, and then if it's not covered by insurance, what then? But you will help them navigate.
Yeah, we'll
that.
help them navigate. And if they do want to apply to insurance, we also can get them connected with our, I forget their names, but we have some specialists in insurance that can help them apply for Medicaid if they want to. So we have like connections and networks with people that can help them get established in insurance if they need that. But we also help them understand, like if they have a copay, we can kind of go in and see like, okay, what's your copay? And if that they can't pay their copay, then we also have the Olivia Fund. I don't know if you guys heard of it.
That was our next question.
Yeah, but we have that program that has been utilized a lot. So it's a really great program that Eagle Valley Behavioral Health has, which is 6 free therapy sessions that are covered, and anyone can apply for it. It's not just for someone that's low income. Anyone can apply for it. So we have a lot of people applying and using that as a source to pay for therapy.
And then do you match them, the potential patient, with therapists specifically?
Yeah, so once we finish the application is super simple. I just ask for like their name, if they're an employer, because then it asks all those questions, like mailing address, and then I would just kind of ask for like an annual income, and just like super simple questions. But from there, we can specialize it if a client wants like their preferred language, or what specialties do they want, like anxiety, depression, or grief, loss, anything that they're going through will help us kind of filter through, and then I'll bring up a list of therapists that are most appropriate to them.
Great.
And I think, one of the things that a lot of people don't know that I think is important to mention here is this misconception that you brought up, that Olivia's Fund is only for folks that are in really dire financial circumstances. And that's really something that we want to start breaking the stigma around, because it's not the case. And one of the things that is very challenging in our community, for example, is a lot of providers, private providers, don't accept insurance. And so we've been able to work with them hand in hand to get them to accept this program specifically.
Awesome.
So perhaps, we have folks in there that are doing, biofeedback, or, neurofeedback is what the specific type that they provide. We have folks that are doing, very specialized treatments. We could do neurodevelopmental evaluations. We could do learning disability evaluations. Like a lot of these services that are, oftentimes really costly, and when they're not run by insurance, where insurance won't help you pay for it, can really be a barrier, So-
Prohibitive.
Very,
That's
very good
prohibitive
to
for
know.
people.
Yeah.
Even with the learning disabilities, because a lot of times that's missed. I can speak personally. I was lucky. My daughter, who's special needs, got diagnosed early and had support here in the Valley at 6 months old. But I know a lot of her classmates that were in her class didn't know where to go. And people ask me still to this day, where do you go? How do you do that? I have no idea. So thank you for that, because I now can tell them where they have a resource.
Absolutely.
I love that.
Well, and it's a starting point, because I do
Yeah.
think it's such a big sort of labyrinth of opportunities and resources, and where do you go, and so I just think that, just even speaking with you two, the fact that there's a one-stop place to start
Yeah.
here.
Yeah.
And that's what's key. You don't have to go through the yellow pages, you don't have to go through they exist, or the internet.
Yes.
But the answer's right here.
Yeah,
So the
without a
information
cost,
will be provided
without a
without a
cost,
cost.
and so having the resources, so.
So please clarify for our viewers, where exactly are you located in Edwards? And share a little bit about the vision, because it's been in the papers, we've seen drawings, but share with us what this is going to look like probably in a couple of years.
Yeah, absolutely. So this is the Edwards Community Health Campus is what we are calling it. And we are located right off I-70 and the first roundabout to your right. So it's kind of where the AT&T and the subway are located. It's
Everyone knows this.
Everybody knows that. Good landmarks.
Yeah, exactly. So this is where we're located, and you may have heard a little bit about the plan for building our inpatient hospital facility, which is also going to be located here off to the backside of the campus. And so, we're really excited about this. This is something that is probably going to be built here in the next 2 years, but it's going to be an incredible resource for our community because currently, anybody that has a behavioral health crisis that needs to, get hospitalized is essentially, shipped away from our community to either Denver or Grand Junction, which, both of those are a couple hours away. And it's, we know that recovery is much more effective when it happens in community, in a community-based location where your family's nearby, where, so we're really excited about that. This will be a facility that serves both adults and adolescents. We know that our youth, really struggle in our community, and this is going to be an amazing resource to have here.
So that's in the back where that's a parking lot back there.
Yeah.
Because there's a lot of people asking.
Yeah,
Just so
Yeah.
we can identify that as well. That's
Yeah.
what's going to be going there on the campus.
exactly.
Great.
Much
Yeah.
better use of that space.
Thank you so much. What a value this is to the community, and we just need to spread the word and let people know that those resources are here for everyone.
Thank you so much for your hard work, and the entire community is grateful for what you do.
Thank you for
Thank
having
you.
us.
Thank
Yes,
you
we're
for having
excited to share about this. So, yeah.
Yes.
And please call us. We're here.
Yeah.